There certainly is a neurological component of it, the nervous system component that does make it unique, and that it's not just about talking about the thing. Like there is value, of course, in therapy and being able to talk through a problem, but sometimes we can actually make it worse if we just keep talking about it.
I want to ask you a little bit about EMDR. So, you're a
Mhm.
certified EMDR therapist. What do you find the most beneficial about this modality?
I've been doing EMDR for a long time, 21 years. So back then, people were like, what? It was 2005, so it was a little wonky. We didn't have all the good brain research that we have now. I love that with science has kind of caught up. But yeah, it's a very powerful intervention, one of the most effective interventions that I know for resolving trauma. And I do think it's very flexible too, because you can adapt it to so many different kind of applications and protocols. It pairs very nicely with so many other therapeutic modalities. So it's not like there's ever going to be this, I am doing EMDR and it's like this scripted, weird, canned thing. Like if anyone is doing it that way, that's not how it's supposed to be done. It's meant to be this really lovely addition to your toolbox that you can then integrate with more attachment based or IFS work or more somatic work or whatever it is that you are also doing to be able to bring in different levels of healing. Ultimately, it's an exposure therapy, right? And so that is like a revisiting of trauma, but we're doing that now in a resourced, safe state, contained kind of way, and allowing people to be able to process and integrate in a way that they weren't able to when they first went through the thing that was traumatic. And then it works really great for other things outside of specific trauma stuff too, in terms of phobias or physical health stuff, chronic pain. It's great for like performance enhancement, like athletes use it for performance enhancement. So it's great for lots of different applications. So I'm a fan for sure.
Yeah. Yeah. And I was going to ask you too, are there any clients that it's especially helpful for?
I would say a good majority of my clients I use EMDR with. So I think across the board, if people are coming in with any kind of trauma history, it is definitely so relevant and so helpful. But also, if we've got performance anxiety or we've got pain or we've got disconnection from the body, even like people that are just more dissociative and kind of have a hard time, we can use it just to start to track sensations and grow awareness and be able to follow a little bit through the body. And so I use it a lot with all my individual clients anyway, certainly. And if I've got couples where I'm seeing trauma is a primary thing that's happening and I'm not treating it within our work, then I do definitely make recommendations that they get some support for individual work as well.
Yeah. And what
Mhm.
makes EMDR different from other modalities? Like what makes it unique?
There certainly is a neurological component of it, the nervous system component that does make it unique, and that it's not just about talking about the thing. Like there is value, of course, in therapy and being able to talk through a problem, but sometimes we can actually make it worse if we just keep talking about it. And we kind of develop these well rehearsed stories and kind of grooves neurologically, even if you kind of think about it that way. And so pre and post, we can see changes, structural changes in the brain with the EMDR. And that's the cool thing is that we can shrink your amygdala and make your nervous system less reactive, right? And so I think is really potent in being able to shift things in a really dramatic way that is unique to this modality compared to others.
Oh, I love that. That is so cool. I love hearing about the
Mhm.
science behind that, that you can see before and afters.
Yeah,
Yeah.
it is pretty wild. And so that's why it's one of the top treatment recommendations for veterans, right? And for PTSD and lots of different populations and applications for it.